Hey, so this is a functional vision assessment. When you're not sure what people are seeing and there's something going on that they're not reading correctly, writing correctly, or complain of a visual problem, excuse me. This is called the random plane circle simple test. The instructions are just number the bubbles 1 to 20 and you time it. That's all they get to hear. And then you have them connect their numbers to see how they see the world. So if you see this, the person has a hard time going past midline on the top part of the paper, and they don't know to drop down and continue to go all the way to the right and then go left to right, top to bottom. And over here, they were worried about, how am I doing? A performance anxiety occurred. Over here, they forgot what they were doing based on the anxiety up there. So just be aware, if you're assessing someone, integrate the information of they were nervous, they were performing, and they wondered how they were doing, and had a hard time even knowing what they were writing, missing some bubbles altogether, repeating some bubbles in there. So what do? You have choices. You can move to the next one, which is a random plane circles crowded one with a reading block, so that there is a way to train left to right past the midline spot if there's a problem at the optic chiasm with the vision or a visual loss from one eye to the other. And they work their way down nice and slow to the end. Training would be hand-eye coordination like this, and saccadic work with this kind of sheet of paper with a reading block. Left to right, left to right. Start seated, work up to standing on that. Same with this one. So it's more of a scanning participatory activity plus the reading block. Like so. Again, left to right, seated, then try it standing. The standing is going to be hard because the reading block won't be there. That would be the way to train the visual scanning, saccades, processing, hand-eye coordination, neurological information. This could be doing therapy for post-stroke patient, a palsy patient, a visual loss patient, head injury client. Who else? Anybody you're noticing, even a child could do this for practice to get the visual information left to right past midline and top to bottom. Breathing is key. Remind them to breathe so they don't hold their breath, and then they make mistakes. If they make mistakes, ask them to fix them. So you'll notice this is a very interesting assessment. I did talk the person through this one at a time with this reading block. And they kind of like to see that they can complete a task. And then carry this over for functional tasks like information from fork, spoon, knife, from left to right, maybe the plate of food. You can ask what's on it, move the information on their table left to right and ask them to find things. Put it in functional context, because people remember better. And that's all I have for now for the vision rehab neurological information. If you have a question, leave it for me, drop it in the comments, and thanks for stopping by at Breathing Through with Christine.